So welcome back guys. Today in this session we'll be talking about the National Health Policy 2017. So here if we talk about the NHP, right, that is the National Health Policy, right, it is to be in effect for 5 years, right, that is up to 2022, right. So here we shall be seeing that it is coming under which ministry. It is coming under the Ministry of Health and Family Welfare, right. So Ministry of Health and Family Welfare, guys, they have actually formulated the National Health Policy 2017, right, after a gap of about 15 years to address the current and the emerging challenges which are necessitated by changing the socio-economic and the epidemiological landscape. Since the last National Health Policy, it came in 2002. So almost about 15 years. After the 15 years, they have introduced this National Health Policy, right. So after the 2002, this 2017 version came, and that is to be effective for 5 years, right. Okay, here are some salient features for this particular policy, like extensive and inclusive consultation processes, promotive and preventive focus, primary healthcare to be comprehensive and universal, and all of these things over here, right. Make in India initiative is also one of the part of it, right, that was included in the National Health Policy, right. So these are some of the innovations. Full use of the digital technology for the interventions in the healthcare sector. This is also one of the inclusions which have been made over here, right. So you can be seeing over here right now on your screen, these are the salient features of the National Health Policy, right. Now let me talk about the main ones over here in the National Health Policy, which we shall be remembering, right, for our particular exams, right. So over here, guys, we shall be remembering that the life expectancy has been increased from 67.5. So it earlier it was 67.5, right, 67.5. Now it has been increased to 70 by 2025, right. That is the target. Establish daily, right, disability adjustment life years. It is a measure of burden or trend of disease by 2022, right. Establish Delhi as a measure of this one. Total fertility rate 2.1 by the year 2025. Under 5 mortality rate 23 by the year 2025. Maternal mortality ratio 100 by 2020. Infant mortality rate 28 by the year 2019. Neonatal mortality rate 16 by the year 2025. And single digit, right, SBR single digit by the year 2025. Achieve 90-90-90 for HIV AIDS 2020 by the year 2020, right. So 90-90-90 means 90% destruction, 90% treated, and 90% viral load remission, right, by the year of around 2020. That is the 90-90-90 rule. So again, guys, 90-90-90 rule is the destruction, treated, and the remission of the viral load. That is the 90-90-90 rule over here. Eliminate the leprosy by the year 2018, Kala Azar by the year 2017, lymphatic filariasis again by the year 2017. TB cure rate more than 85% and TB elimination rate by the year 2025, right. So prevalence of the blindness 0.25 per thousand by 2025 and reduce burden by the 1/3, right. Here I have formulated these important points over here in one slide only. Otherwise by writing there is if I will be writing these kind of points, so it will be taking a lot of time. So that's why I have just formulated them in one place, right. So it might be blurred in your screen right now, but still I am just pronouncing them. So reduce premature mortality from the cardiovascular disease, cancer, diabetes, and the other chronic respiratory disease by 25% by the year 2025, right. So these are some values which we need to remember for our exams, right. So the main one also I will be highlighting at the end of this session. Then increase utilization of the public health facilities by the year 2025. It should be reduced, it should be increased utilization I'm talking about. That is the public health facility, that is to be increased by 50% by the year 2025 over here, right. Antenatal care coverage more than 90% and the skilled attendance at birth more than 90% by the year 2025. 90% of the newborn are fully immunized by the year of age by 2025. Fully immunization they are talking about. 90% met need of family planning by the year 2025 over here, right. 80% of the cases of hypertension and diabetes, they will maintain the controlled disease status by 2025, right. Prevalence of the tobacco use by 15% by 2020 and 30% by the 2025, right. 40% reduction in the prevalence of stunting of under 5 children, that was asked once. So please guys remember this one. This is the very important one over here. Then access to safe water and the sanitation to all by 2020, that was Swachh Bharat Abhiyan. That is also very, very important. Reduction of the occupational injury by 50% in agriculture factors by 2020, right? Health expenditure by government by 1.15% to 2.5% of GDP by 2025, and increased state health sector spending to more than 8% of their budget by 2020, right? Now let me tell you what are the important points over here which we need to remember, right? So over here, guys, which we need to remember, that is the very first one: increased life expectancy from 67.5 to 70 by the year 2025 over here, right? Then we shall be remembering the total fertility rate, which is 2.1 by the year 2025, that is a target. Maternal mortality ratio 100 by the 2020, that we should remember over here. Infant mortality rate 28 by the year 2019, that has already been passed, right? So for your future MCQs, I will be saying that just remove these one also, right? I will be asking you to remember these ones, right? These will be important, right? For an example, neonatal mortality rate 16 by 2025, that will be important, right? 90 to 90 for HIV AIDS, that is kind of a historical question for us now. Then I will be asking you to remember, please remember TB cure rate more than 85% and TB elimination by 2025. They are targeting for that. Then they are targeting for prevalence of the blindness 0.25%, 0.25 per 1000 by 2025. This is also something which we should remember. Then we should be remembering the antenatal care coverage, right? And the skilled attendance at birth more than 90% by the year 2025, right? And we shall be remembering the tobacco, prevalence of tobacco use, right? That is 30% by the 2025, that might be asked. And I told you already 40% reduction in the stunting rate of under 5 children by 2025, that is also very, very important, right? And if you can remember, then please remember health expenditure by government has been increased from 1.15 to 2.5% of the GDP by 2025, right? So these were some points, important points about the National Health Mission. There is nothing like concept which I shall be explaining you over here. There is no concept. These are just pure numerical values which you need to remember, which I need to remember, right? There is nothing. This data which is provided by the government to us, right? So there is nothing which I can do about it, like I can explain that how you can remember this one and that one, right? So that is about the National Health Mission 2017, right? So some of the values which I have highlighted with the yellow color, you might be remembering them for your exams, right? So all the best. I will be seeing you in the next one. Thank you.